is 5:31. As the quorum of the board is in attendance, I would like to call the order of the meeting of the Central Health Board of Managers. The first item of business is citizen communication. Ivan?
Hi everyone, Ivan Davila, Director of Communications and Community Engagement at Central Health, and everyone who's signed up to speak knows the rules and guidelines, process and guidelines for citizens communication and public hearing. The first person to speak is me, Ivan Davila, Director of Communications and Community Engagement here at Central Health. It is my honor and privilege to inform you guys that we have a new staff member in our Department of Communications and Community Engagement, hashtag the Dream Team. Her name is Jana Allen, and Jana Allen is our new Program Manager of Communications and Community Engagement. She comes with extensive experience around leading community efforts to bring new services to underserved areas. More recently, she was working with Austin Voices for Education, and she was big. She played a major role in bringing a food pantry to the Lanier High School and the vertical team at Lanier campus, as well as managing the Football Rapido resource fair. And so, without further ado, she also speaks Spanish. So let me introduce you to Jen Allen.
Bienvenidos. Bienvenidos. Estoy agradecido a apoyar la misión de Central Health. I'm really grateful to support the mission of Central Health, and thank you, Yvonne, for that introduction. So my name is Jana Allen, and it's my privilege to come into this role. And prior to coming to Austin, I was working with Austin Voices, as he mentioned, but I was also living in Portland, Oregon. And so far, one of the biggest accomplishments of my career was doing community engagement, facilitating community conversations, and asset mapping around a program called the 3 to PhD initiative that informed the creation of a school-based wellness center. And so that work informs a lot of the things that I feel that I bring to this position, this role, and I'm excited to be here with you all today. I assume that's my time? Okay.
That was a bus time.
Oh, okay. Well, with that being said, I'm very excited to be a part of this team, and I just look forward to empowering everything that communication and community engagement already has going, and specifically focusing on some of the expansion efforts with the Eastern Travis County initiatives. I'm excited to get to know those residents and to see how we can get more residents involved in those advisory committees. So thank you all so much. Appreciate it.
Thank you.
Well, welcome. Thank you.
Next up, Stephanie McDonald with Central Health.
So I have two parts to this. So the first one is that change is always constant in life, is that right? But we do have a new manager to welcome, Julie Zuniga. This is your first actual board meeting, although you've been attending many of the committee meetings. So welcome to Dr. Zuniga. And she did graduate her nursing class, so I think is ready to commit for the summer. Is that right?
That's right. Well,
but we have some bittersweet news and the bittersweet change that's coming to. This person has been a constant for us at Central Health and at Travis County and the Travis County Attorney's Office. This is Cheryl Carter's last meeting with us. And she is going to go work a little bit closer to home at the Round Rock Independent School District. We are so very sad to lose Cheryl. For one thing, she is instrumental in getting our agendas together, all the motions. I don't know if she's going to train someone before she leaves, but that is... The other thing that she does is she talks football with Mike Giesland. I am not sure who's going to fill that role. Holly, what are we doing? But Cheryl, thank you for all the time you spent here with us. We're going to very much miss you, and you're such an integral part of our team. Thank you.
Thank you, Cheryl. We'll miss you. Yvonne, anyone else?
That was it.
That it? Okay. All right. Agenda items 3, 12, and 13 will not be discussed this evening, but those items are 3, discuss and take appropriate action on the criteria for appointments made by the Central Health Board of Managers as recommended by the Executive Committee. 12, discuss and take appropriate action on Central Health owned or occupied real property, including the downtown campus and properties located in eastern Travis County. 13, receive and discuss a report from the President and CEO on central health operations and current activities, including A, the fiscal year 2019 strategic work plan and operational priorities, and B, an assessment of systems and processes, and C, other personnel matters. Okay, so those will not be discussed. Consent agenda. C1, approve the minutes of the following meetings of the Central Health Board of Managers, March 20, 2019, and March 27, 2019, and C, April 24, 2019 is not ready at this time. Okay. C2, receive a report of the April 2019 financial statements from Central Health as presented to the Budget and Finance Committee. C3, receive a report of the April 2019 financial statements for the Community Care Collaborative as presented to the Budget and Finance Committee. C4, receive the April 2019 investment report and ratify Central Health investments for April 2019. C5, approve and direct the Central Health appointees to the Community Care Collaborative Board of Directors to approve the reallocation of operational costs savings through the Community Care Collaborative fiscal year 2019 budget in order to increase the post-acute care budget for skilled nursing facility services by $600,000 and amend the existing contract with Texas Physical Therapy Specialists to increase the compensation available by $200,000 as recommended by the Budget and Finance Committee. And C6, approve maintaining the current Central Health homestead tax exemption of $85,500 for Travis County residents over 65 or disabled for fiscal year 2020 as recommended by the Budget and Finance Committee.
I move that we approve the consent agenda items C1 through C6 because the yellow sheet, it says C5.
Do I hear a second?
Second.
I have a motion by Manager Valadez, seconded by Manager Greenberg. Any discussion? All in favor say aye.
Aye.
Anyone against? Anyone abstaining? Manager Jones. I just showed that Manager Jones will be abstaining. All right, motion passes. Regular agenda. Agenda item 1, receive and discuss an update on the 86th Texas Legislative Session and Central Health legislative priorities. Ms. Cavazos. Thank you, brother.
Actually, I don't mind standing. You don't mind standing? I can sit all day. I have a couple of news articles, so. Sure. Good evening, Mr. Chair and managers. I just want to give a very brief legislative update. I'm still sifting through the ashes of the 86th legislative session, which adjourned Monday, sine die. What I can tell you is that of 7,324 bills that were filed, 1,429 House and Senate bills have passed. This is a little bit more than last session. 6 bills have been vetoed. The governor has until June 16 to act on bills that are sitting on his desk. And so we'll know more at that time. So I'd like to request to come back at your June regular board meeting and give a full overview. But what I want to say is that overall Central Health had a successful legislative session. We passed our 2 priority bills, which were the physician bill, which allows us to hire physicians to practice medicine, and that's effective immediately, and staff is doing the planning to implement that legislation. And then the local provider participation fund bill, which allows us to create an LPPF, that also passed. That bill is in the governor's office. Again, he has until June 16th to take action. Staff is also in planning mode to get that LPPF implemented. We don't foresee that he would veto it, but we will know for certain on June 16th. I also, over the weekend, the legislature passed Senate Bill 2, which was the major tax bill that we've been monitoring all session. And if you haven't heard, I'm happy to report that we are out of the bill. So we will get to maintain our 8% rollback rate. Cities and counties, well, let me go back. The other taxing entities that also were exempted from the bill, just, so you know, is also junior college districts, so ACC, and any taxing unit other than a school district, which has a maintenance and operation tax rate at 2.5 cents or less per $100 valuation, so very tiny taxing entities. Unfortunately, our city and county partners will be held at 3.5% rollback rate. They do have the opportunity to carry over incremental unused tax rate every 3 years. And at least one of the articles that I passed around there talks about how the city of Austin is projecting that it will be at a deficit of $18.5 million in fiscal year 2021, and they're projecting that deficit will be $58 million by 2024. And the county is fairly similar. I got a memo from them this morning, some estimates they did in April on it. They were projecting a $13 million deficit in 2021 and $58 million in 2024. So just wanted to put that information out there. The only other bill that I want to talk to you about, because some of you have been asking me through session, is Senate Bill 22, which is the bill that prevents local governments and state government from using taxpayer revenue to contract with certain healthcare providers, namely Planned Parenthood. And that bill did pass, and it's sitting at the governor's desk, and I'm sure he will sign that very soon. If you have any specific questions about that bill, I'm happy to answer them. Other than that, that's my presentation, and look forward to coming back later in June to give a more full report.
Angela Satif?
Thank you, Chair. Well, first of all, thank you, Perla. I really want to commend you on all your efforts and sleepless nights and late texts that we've had. Thank you for everything that you have done for the organization and for the community in Travis County. We appreciate your work and all the representatives and senators who helped you as well. My question is related to Senate Bill 22. How would it impact us, Central Health? And as you know, we are supporters of Planned Parenthood and want to continue on services for women in Travis County. So is there any liabilities? So how does it really impact us directly at this moment and in the future?
So my understanding is that we have an existing contract for the next 9 years. And so it should not impact that contract. And other than that, we'll be conferring with our attorneys to see how it impacts us after then. Of course, a lot can happen between now and the next 9 years as well.
So is it fair to say we're good for the next 9 years?
We are good for the next 9 years. And I'm looking at Stephanie.
Okay, thank you.
Yeah. And if you do see Senator Watson out in the community, or Representative Howard or Representative Gina Hinojosa, please thank them for their work helping us pass these two bills. They were, as always, great people to work with, and their staff is wonderful and very helpful as well.
Angela Greenberg?
Well, Perla, you're, as always, very modest, and this was a tremendous undertaking. The Pink Dome is not easy, and so I too want to thank you for your efforts on our behalf.
Thank you.
Manager Valdez?
And to the other organizations that that work with us in a collaborative manner, including CPPP and others. Bedla, thank you very much. They've talked about you, so
Thank you.
thank you. Congratulations.
Carlos,
Felicidades.
thank you for all your hard
Oh,
work and your
sure.
staff. Thank you.
It takes a village, so I thank
That's
those
right.
of you who also went to the Capitol on our behalf. Dr. Zamora.
Of course, anytime. My pleasure. Anyone else? Any questions? All right, thank you. Thank you, Bella. This is just an informational item, no action is necessary. All right. Agenda item 2, discuss and take appropriate action on the appointment of Pilar Sanchez to the Community Care Board of Directors. Ms. McDonald.
In your packet was a memo from Mike to you that tells a little bit more about Ms. Sanchez and her commitment to serve on the Community Care Board of Directors. As you know, we make 2 appointments. She will be taking the seat that had been previously held by Fletcher Brown. Fletcher had been in this seat and had served on the Community Care Board of Directors for a number of years. I'm happy to answer any questions.
Let's get a motion on the floor first.
I move that we go ahead and approve the recommendation of Pilar Sanchez to the Board of Directors for the Central Texas Community Health Center, DBA, also community care.
All right, so we have a motion on the floor by Manager Valdez, seconded by Manager Greenberg. Any discussion? Manager Gonzalez.
Thank you, Chair. Well, I just want to thank Ms. Sanchez for taking this role. Appreciate her serving on this really critical and important role. We hope in the future to see her, to connect a face, and we also encourage her later on to come and visit us as her work progresses with community care. Thank you.
That's community care.
Any other questions, managers? Seeing none, all in favor say aye.
Aye.
All against say no. Any abstentions? Motion passes. Agenda item 4, consider and take appropriate action on a tool and a process to be used to evaluate the President and CEO's performance during the period of June 2019 through May 2020 as recommended by the Executive Committee. Ms. Willers will be available for questions. I think everyone has seen this tool. Maybe not Julie, Zuniga.
And the tool in your packet is incomplete, so I'm just going to give you a completed tool.
So I want to announce to the public that our 9th board member, Abigail Akins, is on the phone with us. Everyone else is here. Manager Bell.
I'd just like to say for Ms. Sunega, who I know I was in her place at one point in time, and a lot of this stuff is totally confusing. This tool is for next May. Okay?
Yes.
So that's right. So the one we've been working with is the one for this year, but this tool is for next year. Okay? All right.
There you go. And any questions? Okay, can I get a motion on the floor?
I move the board approve the president and CEO's performance evaluation tool to be used during the period of June 2019 to May 2020 as recommended by the executive committee.
Second.
Okay, so I have a motion by Manager Musaitis, seconded by Manager Bell. Any other further questions of Ms. Willers?
Yep.
Seeing none, all in favor say aye. Aye.
Aye.
Okay, all against say no. She can't vote. Council says no.
Why?
So there is no voting allowed unless you are participating via
Skype.
teleconference.
Oh, she didn't Skype. Yeah,
Oh.
it's a teleconference.
Sorry,
Okay.
there we go.
Yeah. Sorry, Abby. Yeah, you had to do the teleconference. Why,
Oh, I didn't realize that. Sorry, guys.
why isn't she on teleconference? Oh, got it.
Right.
Well, if you, ma'am,
Sure.
so, just a, point of information. If she, later on in this meeting, is at a location where she can teleconference, then at that point she could vote, correct?
And she would be counted towards the quorum,
Then she
and her
beca-
vote would actually also be counted.
So, Manager Aiken, did you hear that? If you, at some point during this meeting, or are at a location where you can teleconference in as opposed to phone, then you would be counted towards the quorum and your vote would be counted.
Copy that.
Got it.
All against say no. Anyone abstaining, so motion passes. Thank you. Agenda item 5, discuss and take appropriate action on the proposed amendments to the Central Health bylaws as recommended by the Ad hoc Bylaws Committee. Holly?
Good evening, managers. I hope to make this a relatively short presentation. As you know, this board voted to create a committee called the Ad hoc Bylaws Committee, which met 3 times over the course of, I guess, April and May, but maybe just May. And we spent a lot of time looking at the document that is in your backup. And I myself am going to get there, and I'll provide you a page number when I do. So it looks like it starts on page 98 is the clean version, and the red line version begins on page 74. So I will be working from the red line version because that's where you can see all the changes that were made. And I just want to point out a few changes that were made. I'm not, again, these were extensive changes that were considered by the Ad hoc Bylaws Committee, so I'm just going to point out those that were larger changes. So beginning in the definitions section, specifically on page 76, you will see that we have added 2 definitions. One is a definition of Travis County, and then on page 77, there was a definition of program budget added. Moving on, the purpose of the district was refined slightly to include providing hospital and medical care. As you know, that's the statutory language in Chapter 281, and any other lawful purpose. Moving on to Article 3, the largest change there was a deletion of subsection I, which was a requirement to conduct a board self-assessment. I want to point out that that is still a permissible activity. I just didn't think it was wise, and I think the committee agreed with me, to have a requirement if we didn't want to do that. Moving on to, let's see, Article 6, which is officers of the board. That's where I see another large change. So the large change happens in section 6.4, but I just want to point out before 6.4 something that comes up frequently, which is the order of who fills in the chair's absence. So if the chair is, for whatever reason, unable to approve an agenda or to attend a meeting, then it falls to the vice chairperson, who, if the vice chairperson becomes unavailable, it falls to the secretary, Ms. Aiken, and then finally to the treasurer, Dr. Bell. Moving on to 6.4, one change that was made here is instead of annually, the officer elections will be held every 2 years to conform to our current practice. However, there is an option for the board to decide that they would like to receive nominations for board officers prior to the 2nd year of the officer's term. And that's all spelled out here in 6.4. Also in 6.8, because we've extended the number of years that officer holds a position, the term that anyone can serve is just 1 term of 2 years, unless 2/3 of the board vote to suspend the term limits imposed by these bylaws. Let's move on. We made several changes in Article 7, starting on page 82, to committees. So most of the changes in budget and finance were cleanup changes, meaning I tried to make changes based on what I considered to be clearer language, or there were section reference updates. So the biggest changes actually in Article 7 start at 7.1, which is our executive committee. And the executive committee has several responsibilities, one of which was added, which is consideration of items for future board discussions. This is something that several board members voiced a desire to have as an outlet for bringing forth items that they'd like to hear on future board agendas. The Strategic Planning Committee had, in 7.2, some changes. Again, mostly what I consider cleanup changes, just to make it easier to read or to conform to definitions. However, the Real Estate Committee, beginning on page 86, has expanded authorities under these new bylaws. Instead of just being responsible for managing the reuse and redevelopment of the downtown campus, they are now also responsible for developing and making recommendation to the board on other proposed real estate matters. Let's see. Moving on to Article 8. I'd like to point out a change that was made to Section 8.15, which is on page 91. One thing that has been added since we discussed last is that the chair may optionally establish time limits for discussion of each agenda item without the necessity of receiving a 2/3 vote of the board, which would be otherwise required by Robert's rules. And that was an effort to help facilitate meetings to ensure that everyone could stay for the entire meeting and that we were efficiently accomplishing business when possible. Let's see. Moving on to Article 9, which is the President and CEO's authority. Again, here I made mostly cleanup changes, but I did want to point out subsection G, make budget transfers between line items within the same program budget. That's why there's a definition of program budget now at the beginning of your bylaws. Moving to page 95, Article 11, Indemnity and Insurance. You'll see lots of changes here. Those changes were made to conform this document with what was approved for Sendero. Sendero's council had recommended some very great additions, and I have incorporated them here. And those are the changes I wanted to talk with you about today. If you have any questions, I'm sure myself or Cynthia would be able to answer them.
Benjamin,
Like a motion?
I would love one.
I move that the board approve the proposed amendments to the central health bylaws as recommended by the ad hoc bylaws committee.
So I have a motion by Manager Bell, seconded by Manager Greenberg. Any questions?
I just have one.
Manager Greenberg.
I just want to thank our chair of this ad hoc committee, Manager Valadez, and she did this is not easy. This is very technical work, and she did a fabulous job in a short amount of time of guiding the committee through this. I also want to thank our council, who I know spent countless hours, as well as the other members of the ad hoc subcommittee and other staff who I probably don't even know all of their names. But so thank you, everyone, because this was an additional item for people to take on. Thank you.
Okay, so Manager Moisaktov's hand.
Thank you, Chair. Holly, I have a question. I think I sent this addition to you. On page 12, item 7.7, the appointment and term for committee, is this for committee chairs for 1 year?
It's for the actual committee members. Your recommendation to change the term of committee members to 2 years was not something that was adopted by the actual ad hoc bylaws committee.
Okay. So if this is clear, so the committee by itself needs to be changed every year. The chair can keep their position for whatever I'm like the chairperson, so
Let me,
clarify that.
if you don't mind, Holly, did you want to answer that, or do you want me to answer that?
Why don't you try it and then I'll go from there.
Okay. With respect to that proposed language change, it was felt that this would provide board members an opportunity to sit on a particular committee that they might not have previously been appointed to. So it would provide the chair the option of being able to move around and have gained the experience of another committee that they might have not have been appointed to. And so that's a flexible. You could maintain the same membership, or you could change it depending on the wish of the chair. If there was any concern, there's always the practice that we already have in place, and that is to talk to the chair or come to the executive committee and plead the case.
If I may, I probably want to clarify my question. The chair of the committee, how long can they hold their position? That's the question that I really wanted clarification.
There was no distinction made with respect to a member or committee chair. That's one and the same, and that's a one-year term.
So it's under the prerogative of the chair to keep the chair of the committee as long as he wants or she wants. Is that correct?
Correct.
I just wanted clarification on that end.
That is correct.
Okay, thank you.
Manager Bell?
I just want to echo Manager Greenberg's thanks, both to Manager Valadez. She did an excellent job. I didn't get to attend all of the meetings, but I did get to attend some. It's not a difficult task going through these bylaws and trying to figure out what people, how to address people's concerns, but she did an excellent job at that. And of course, Holly, always appreciative for the great work that you do.
Thank you.
Manager Aller?
Yeah, I'll reiterate. Great job, Cynthia and Holly. On the change that limits the discussion, is there any thought to, like, do we each get equal time? So that, you know what I mean? So that one person doesn't take the entire, like, they're 10 minutes slotted, but we, or can consideration be made for that? So that we each have, if we have concerns, we can address something?
So at least for our bylaws, the change just says that he can establish time limits. It doesn't describe how he can carve out that time limit. So I think there's flexibility in considering everyone gets 5 minutes, or if you've gone over 2 minutes, that we have to point of order.
Okay.
Manager Greenberg, I'm gonna skip Manager Jones and go to Manager Greenberg.
So I would just say that although it's not in the language here, the discussion within the ad hoc committee was exactly what you're saying, Manager Oliver, that it would conform to what you see at, in the Texas legislature or in a city council where, each member gets a certain amount of time. So we did have that discussion.
At least there's intent there.
Yeah,
That's
there's
exactly right.
Legislative intent, yes.
Manager Jones?
But to the point also, there's always a point of order that can be
Yes.
called at any point in time.
Right.
And I think, so the belief was that, yes, we're going to expect that. We expect our members to be responsible for all of us in terms of timing. Just two questions. First, thanks very much for your leadership in getting us through
Thank you,
this
Shannon,
process.
for being there.
This is quite a challenge, I know. And Holly, as always, thank you for your great work and support. Just two things I want to highlight. One we've just done, so I won't need to redo that one. But the executive committee has the opportunity, I want to emphasize, the opportunity to place on the agenda items things that board members, if they can convince them to add to that. So I want to acknowledge that is one of the changes that we've made here as well. That was the only other one, other than the time limit.
And thank you, Manager Jones, for bringing that up, but that is actually reverting to an original practice that we had on the Central Health Board of Managers when Sherry and I came on. That was one of the reasons that we looked at the executive committee being reinstated as an opportunity for board members to be able to go, to provide input, and to plead their case for any agenda item that may need to be added. And just as a last-minute comment, I wanted to thank all the board members that provided input, that sent comments to Emily or to Holly or to Stephanie with respect, or to me, thank you, Dr. Bell, with respect to any proposed language change or modification of our existing bylaws. I want to thank them. They did a great job. Everybody everybody is appreciated for the work that they did and their contributions to the bylaws that we hope will accept unanimously. Thank you, Dr. Samota, for appointing me.
Of course. Any other questions?
Sherry?
Thank you, Cynthia. Thank you, Holly, for all this hard work. We really appreciate that. All right, so now we have a motion on the floor. All in favor say aye.
Aye.
All against say no. Anyone abstaining? Motion passes. I'm going to go back to the agenda because I was just informed that we're going to have one more agenda item that we will not be discussing tonight. This agenda item is number 10. Discuss and take appropriate action on the 1115 Medicaid waiver delivery system reform incentive payments, DISRA projects, the Community Care Collaborative, including the health care delivery arrangements, and other interrelated community partnerships. We will not be discussing this tonight. All right, so let's move on to agenda item 6. Discuss and take appropriate action on the roadmap and charter for Capital City Innovations, Inc., a nonprofit corporation organized and operated to support an innovation zone that enhances healthcare for residents of Austin, Texas. Mr. Giebel and Ms. McDonald.
So members, we're available to answer any questions, and I know the board's discussed this at length, and the backup materials are the same as, that's in the board packet, the same as what you've seen before. I'll just be brief. After going back through this document and taking some more time to understand where this is headed, I would like to recommend passage of this for the simple reason that it enables a business plan to be put together, and it gives us something to look at. That's how I distill this and like to think about it. When you think about the Brackenridge track and how it all fits into what's happening in that part of downtown, at some point we will need to go beyond where we are now, which is the mechanics of the development, and looking into how do we market this property, what are the programs going to be, how are we going to satisfy the master plan in terms of the uses of the property. So we're going to need to expend some funds to be able to do that. And this roadmap will produce another option so that the board can look at it and say, yes, this is where we want to head, or we want to go do something different. But it never hurts to have an alternative business plan put in front of you. So that's what I'm recommending.
Stephanie?
Thank you.
Anything else, sir? Good. Do I hear a motion?
Well, can I say a motion? I move the board approve drafting of a roadmap and charter for Capital City Innovation to guide the strategic development of a patient-centered consortium health innovation district.
There, second?
So I'm so sorry, but the roadmap and charter has already been drafted. So if you would just repeat your motion without the drafting.
Okay. I move that the board approve of a roadmap and charter for Capital City Innovation to guide the strategic development of a patient-centered consortium health innovation district.
Do I hear a second? Andrew Jones? You second? So we have a motion by Manager Musaitiv, seconded by Manager Jones. Any discussion? Manager Musaitiv.
Thank you, Chair. I know Chris Lang is not here with us tonight. So and I think right now, given this time and space, and we're in the development of the downtown property, it's really critical to get some insight and from CCI, and to use them as a resource as well. I would recommend that CCI, whoever, to come and present to us towards the end of the year to see probably their developments, what they have accomplished the next few months or so. So that's really what I'm proposing for him to come to our meetings toward the end of the year.
Good.
That can be done. Manager Oliver?
And Holly, this may be a question for you. What are our obligations as a partner in CCI? And I noticed that this roadmap says that it'll be an organization where partners can come in, but they can also opt out. And I know we're not supposed to pay any money into this, so we would be receiving these, I'm assuming, for our original contribution. But I think where I get a little nervous is knowing the fiduciary duty that partners have to each other. And if something looks really good for UT that may not look as good for us, or conversely, if something looks really good for us, that may not look good for UT and, or whoever our partners are?
So,
What are our obligations as partners?
one of the things, I'm not sure this is going to answer your question, so let me start by saying that. But one of the things that is in the bylaws we just approved is that any appointment we make to an outside entity is for the purpose of serving central health interests. So our board appointee to CCI is there to advocate on behalf of central health interests. Therefore, if that board member feels that a decision of CCI would be detrimental to central health, they would be obligated to vote against whatever action it was that was detrimental to us. And I'm not sure, without looking at the bylaws of CCI right now, or doing a little bit more research into fiduciary obligations, I can answer fully the rest of your question in a manner that it deserves.
Well, I think that's my biggest concern with this is our fiduciary duty as a partner within the CCI. And what does that look like when we have two competing interests for something? And can we be overruled? I guess.
Can you be overruled? Do you mean the board or?
No, like our board advocate on the CCI.
Yeah, because we're only one of, I think, 3 members right now. There may be even now a 4th member. We're just one vote.
Right.
Manager Greenberg?
So, to follow up on that, my understanding has been that we would have no fiduciary responsibility, that we had already, Central Health had already made a financial commitment, and that we would, from this time forward, have no fiduciary responsibility. Is that correct?
I do, again, without looking at the bylaws, think that any time you serve as a member of the board of another organization, there are some both duty of loyalty and duty of care owed to that specific organization that you sit on. But if there were a conflict between their duty to Central Health and their duty to CCI, our bylaws stipulate that our interest will always be paramount. I'm not, again, I'm
Yeah,
not
that's
sure.
not
I'm
exactly
answering
my
your
question.
questions.
My understanding has been that there would be no situation where Central Health would be called upon to contribute money.
That's correct.
Is that correct?
That is my understanding.
Okay, thank you. That is my question.
Manager Musaitis?
Thank you. And also, I believe any final decision will come back to this full board. And I believe that we have appointed a person that works for the benefit of Central Health, and we trust their decision. Ms. McDonald, if something erupts, I think she'll bring it up to the attention to the chair and the CEO. So we have full confidence in a decision-making in the future. Thank you.
Manager Aldez?
Yes, and with respect to the funding, and that's of any kind, including operational, no money for operations, no money for maintenance, no money for anything. $0 being expended out of our budget to support CCI. And in that vein, if I'm not mistaken, is that correct, Holly?
If we're talking about additional capital contributions in any way to CCI, my understanding is that this.
Of any kind?
Yes, of any kind the answer is no additional contributions.
That is my
Okay.
question.
Okay, so that's, I just wanted clarification for that, but my biggest concern is this. Our largest asset is the Brackenridge Tract property, 4.2 acres. That's our only, or that's not our only asset, but it's our biggest asset. And with respect to the creation of CCI, it was always my hope that there would have been some kind of commitment by CCI that we created to give back money or to set aside money that they would have made in their recruitment of entities to come to the innovation zone for the sole purpose of providing services to our targeted population. That did not happen. So I voted against that. And I voted against that because we could not get a commitment from CCI to ensure that there would be, as they look to increasing profits or recruiting entities, growing this workforce, I guess, contingent, that all these things would contribute to what would happen there on this particular track. But with respect to the management of that development, which is of our asset, I truly believe that they did not have and do not have the capacity to be able to manage that. And that if we were going to look at an entity for managing the Breckenridge Tract development, that my hope would be that we as, and I don't know, I assume that when we did this, that there was talk, and in language that I have seen written, it was going to basically let CCI manage whatever was going to happen at the Breckenridge Tract. Is that true or not? Am I mistaken?
Manager, Manager Greenberg.
If I may ask a question, because it's my understanding that in fact, and this is what I do want to assure, and I think this is what you're asking, the Breckenridge tract is owned by Central Health.
That's right.
And we alone have the ability and the responsibility for managing it. It is my understanding that CCI has nothing to do with the development and nothing to do with the management of our Breckenridge tract. Is that correct?
That's correct.
Okay.
So just reading this then, the partners shall agree upon a physical defined boundary of the innovation district that is described by the physical footprints of their collective assets. What is, our asset is Breckenridge. So
That appears to be
it means
a contradiction of
Yeah.
terms.
Excuse me?
I don't, in terms of needing to know what is it that we're going to join forces and try to market this area, and quite frankly, really enhance the value of the Breckenridge tract, if we're going to work with with our adjoining property owners, everybody needs to know what that looks like on some level. So what area is it that we're talking about? That's the purposes for identification. I know one element of the charter, I shouldn't say one element of the charter, it still needs to be drafted, but one principle around the future charter will be that it doesn't infringe on anybody's private property rights. I think going back to your prior question, in terms of creating fiduciary responsibility, with that question in mind, I think going into this, we can have that front and center and be watching to see, are we signing away something? Because even though it doesn't
Right.
infringe upon it,
Mhm.
if you contribute something in a way that sets up that fiduciary responsibility to any one of those other entities, that's not a position that we want to be
No,
in.
I agree.
So I fully understand what you're saying.
And you think that this, as it's written, doesn't obligate us in that?
No, in fact,
capacity?
I think that there is still a lot more drafting to be done, a lot more conversations with this board, and knowing what these questions are in advance helps us watch out for that sort of thing, to make sure that we don't get ourselves into extraordinary fiduciary responsibility that we can't satisfy, and we find ourselves on the other end of the lawsuit.
Right.
Yeah. Understood.
Any other questions?
One last comment, and then I'll be done. Then with respect to the approval of the roadmap and the charter for the CCI, is there going to be any kind of community conversation with respect to the definition of what the innovation district is? As opposed to just the people who have bought into being on the board of directors?
Right. I'll have to go back and look at some of the initial materials. You may know this off the top of your head, Stephanie, but in terms of having a community-centric approach to all of this, I know that is certainly one element of this. In terms of what the outreach schedule would be, the meeting schedule and so forth, I don't know that that's spelled out.
No, I'm talking,
But do you have something that's more informative?
There's different levels of community engagement that have already occurred. I think there is additional engagement. I think if you're asking specifically about how we are going to include, and when I say we, the CCI is going to include the community in conversations, I think it really depends on if this charter and roadmap are adopted, one of the things that is important is that the city of Austin has asked that there be some sort of vehicle going forward to demonstrate there's commitment by the partners. And so that is what this does, is it shows. And then at that point, we can start really talking about how we further engage the larger community. But until we define what we're trying to achieve, it's going to be very difficult to have a conversation about what that engagement looks like. So there is an engagement director. We've already done, for example, this week here, there's a second meeting of the patient access work that we've been doing with the Ford Innovation Lab. That has involved a variety of different community groups, including Meals on Wheels. And it was a very interesting and informative. We had 2 staff members participate in that. And so I think that there's all kinds of different things that are happening that are to engage the community already. But we need something to attach a vehicle for other people to join in.
Response, so similar to the fiduciary responsibility question, again, this feedback is all knowing that, given that it's not spelled out in these illustration documents, we can certainly bring that to the table as a key interest for Central Health.
So, just so I understand the sequence, at what point and what will come back before this board?
I think that is something you all can certainly direct me.
We
at
can,
what
okay.
you could like to see.
Okay.
I think, an annual presentation at the end of this, either this calendar year is what I assume you're saying, definitely. I think we're also going to have some real estate analysis that was done by consultants, HR&A, that will be available in the next few weeks. Happy to bring that back to you all.
But I guess my question is we don't have the final documents yet, is what I just heard. And that there are other, that soon you will be coming back before this board with further details, is that correct?
I think I can certainly come back as to what the status is with the other stakeholders, the key members. So the University of Texas and Seton, there's been movement there, as well as Downtown Austin Alliance and Opportunity Austin, who have both contributed funds already. I can certainly come back and let you know, if they have agreed to the roadmap and charter.
Okay, and then though as things move along, you would come back and discuss with this board what the community engagement plan looks like and some of these other details.
I think I can certainly come back in with more details.
Okay.
Andrew, all those?
With respect to definition of what community is, I'd still like to know what your definition of community is. When I look at the community that we're supposed to be impacting and helping to close the disparities gaps, that is for our most needy population. That's what we were created to do. And as far as I'm concerned, CCI, as it needs to be in alignment with our mission, should also be doing that. And that is with respect, so that means to me, and to other people that I might have had conversations with, how is our community going to benefit? What are the community benefits for this entity with respect to the provision of direct services, the expansion of wraparound services that our population needs as we talk about that, with respect to the inclusion of appropriate stakeholders that mirror the population that we are providing services to, because that doesn't necessarily mean, to me, that is not the Chamber of Commerce, that is not the Downtown Alliance. And so with respect to that, those kinds of definitions and need to include them in the decision-making process, giving them a seat at the table, making sure that they are helping to provide input so that strategies and practices can be incorporated to address their needs and how we're going to get there. Those all are things that have not yet been determined. And so it's very hard for me to vote on something that I do not know will incorporate those things that I think should be priorities for us as we sit here at this board,
So I'm
appointed to maintain that fiduciary responsibility for what we do here.
happy to ask Chris to come back to me, or if, if that was the will of the board, to come back to the board, and kind of detail some of his work in this space. I did just mention the patient access work that we've been doing at the Ford Innovation Lab. That was case studies with our work around Lyft and Ride Austin, and as well as some work that Meals on Wheels has been doing in this space. It's very much answering some of the challenges that we have around getting people to doctor's appointments. Also, I just want to explain a little bit. I think this might help clear up. I'm getting kind of a lot of messages about real estate and assets, and also community and patients and healthcare and who we serve. One of the things that I think is important is that we have already found that Chris and the CCI have a role to play in the work that the 2033 Fund has been doing. And he was not party to Manager Oliver's question to any of those discussions and the negotiations. It was frustrating, I think, to him that he was not able to be a party, but to that point, he didn't need to have two of his members kind of negotiating and have him feeling that he was in the middle. So one of the things that he has done, though, is people have contacted him directly about how they might access real estate or lease space in the block that the 2033 Fund is now leasing from us. And these are not your huge players, the Mercks and the other companies. They have ways to get, they have brokers, they have ways to get directly to the 2033 Fund. But these are people who need maybe half a floor that are interested. And so he already has about 5 people that are expressed interest. So I'm hearing different things, and I want to make sure that we are addressing the different concerns. But I think it's a lot right now that you are asking of CCI. And we'd like to try to meet that challenge, but I do want to be clear that we're trying to do multiple things at once.
Mr. Gillum?
Mr. Valdez, we understand what you're saying, and I'm gonna say something just to make sure that I'm understanding this. But as this roadmap and charter starts to materialize, it's not waiting until after it's been approved to go out and start talking about it. It's during that process where we need to reach out to our contacts in Dove Springs or Colony Park or wherever in Travis County that we're working, that are our patient advocates that we work with, and make sure that they have a seat at the table and have a voice to be able to inform this process. Is that capturing the essence of where you want to go?
Well, that's one of the things that we had hoped would happen when we first looked at or first heard about the development of this entity as being a part of enterprise. And it was to make sure that we had community members that reflect our targeted population sitting at the table, being able to influence decisions and participate in those. With respect to the other, community benefits is not a new concept and has been incorporated into many legal agreements throughout the United States. And so when we first talked about the mass development of the master plan for that particular tract of land, we looked also at how is the community going to benefit? What are the community benefits? But we have to hear from the people who would be benefiting from those. And again, excluding the non-English speaking population, or other than the regular stakeholders who have been communicated with and included in the process, I think from my way of speaking, until we get those kinds of definitions and language incorporated into this, I don't see how I can support it. I would like to see that, because I know that what is important for future purposes is going to be what's in black and white on a paper that's going to be signed by the parties. And if I don't see that there, I can't expect any future board to be able to have that level of commitment. I would hope that they would, but I can't expect anybody to. I can't tie future boards to anything. The only thing I can do is fight my darndest to make sure that what we approve incorporates what our mission is and the people from that population. And so I just have to wait until I can see that language incorporated. Thank you.
Understood. Thank you for clarifying.
Manager Mercedes?
I think this item has come to us how many times? We've had in committees, we've had Chris present to us multiple times, we've discussed it, and what I'm seeing, the same themes, like personally, we're literally repeating ourselves. I understand the concerns of many board members, which is legit, and we all have the same concerns, and understanding, knowing that we will not be allocating any additional funding. This final decision and saying what will happen to the property will come back to us, and giving CCI an opportunity for them to move forward and to gain more capital with this roadmap. And in order for CCI to survive, they need this roadmap and direction. And I believe certainly with the local community, he's a point of contact for any work that is conducted. And we ask, perhaps to him to visit us toward the end of the year to see what updates he had with, hopefully, if this motion passes, if he's able to sustain gather additional capital for him to survive. And we can learn from his expertise. Maybe it's not idealistically what we were looking for, but we should make our investment worthwhile and to learn from what he brings to the table. So that's really my position.
So am I hearing your message? You're calling a question? Is that what you're asking for Manager Mercedes? Or
You know what, can I call the question?
you can call a question anytime. Do you need a second, Holly? Manager Jones? Is that you're calling a question? Second? So I have a motion on the floor to call a question by Manager Mercedes, seconded by Manager Jones. Do I need 2/3 or just 2/3 on that one? So I guess I'm gonna raise hands on that one. So all in favor of calling question? So we got 1, 2, 3, 4, 5, 6. We have 2/3. So we're calling the question. All right, so the motion is still on the floor that, I think, I forgot who made the motion. Manager Mercedes. I don't need to explain to you guys what the message I got from you guys was different. So yes, you're gonna vote in favor of this motion, or no, it's against this motion. So all in favor say aye. Aye. All against say no.
No.
Okay, so we had, motion passes. We have 6 to 2. Thank you. And any abstentions? No one abstains, okay. All right, thank you, board. Thank you, managers. Agenda item 7, discuss and take appropriate action on the use of new innovative funds during fiscal year 2019, including an agreement with Social Financing Inc. and its subsidiary PATH LLC for permanent supportive housing and wraparound services to be provided to the homeless Travis County residents. Holly?
Good evening. If you don't mind, I'll just sit here, but if you'd like me to, I can move to the front.
Don't sit up at the table with the teacher.
You stay where you're at, Holly.
Since we last met on this item, I've had a chance to do what I would deem a sort of quick review of the agreements that Social Finance has presented to the county, to the city of Austin, and to Central Health. And I sent out, or Stephanie sent out on my behalf, Friday evening, some conceptual terms that I would recommend we include in this agreement with Social Finance should the board decide to commit funds for this initiative and then to enter into an agreement. Before I go through those conceptual terms, one thing that I do want to make clear is tonight, the way your motion is written, it is simply a designation of funds from our new initiatives line item. It is not a final approval of the agreement. And the reason for that is, as I said, I haven't done a final review or even a very thorough review of the agreement. And the city and county, at least the county as I understand it, are still making changes and in active negotiations with social finance. So I don't have anything that is ready for you to say, yes, approve the agreement on these terms. So turning to page 153 of your backup, that is where you will see my conceptual terms. And I do want to say now, while I have a moment and you're turning, that I had given direction to social finance that I would provide them with some language before tonight's meeting, and I did not do that. And so I want to apologize to them that they did not have a chance to look at this language, but again, we are not approving any agreement. I'm just putting out some conceptual terms. So the conceptual terms presented, there are 5 terms presented. These terms were presented either because I had heard concerns from board members or staff about the agreement that was presented to us, or because I felt like there may be some legal concerns surrounding a term in the agreement. And so if we get into more of a legal component, I may ask the chair to enter into a closed session so we can talk a little bit more about what the legal implications are. But right now, I'm not anticipating we go that far. So looking at the first bullet point here, one of the things that we've heard in the past is that there's some discomfort about not knowing the identity of the investors who our funds will pay, and not knowing the deal terms that they may enter into with a social finance subsidiary. So a proposed term, and in some of the communications I've had with social finance, I'm not binding them by any means, but they seem amenable to it, that they would seek the consent of the investors to disclose the identities. Now this part they have not agreed to in the deal terms of the financing agreement. So that's one suggestion I have for you for your consideration this evening. The second conceptual term would be a provision that would cap the return to investors at no more than 6.4% of the investor's investment. And Manager Valadez already asked me why 6.4%. And the reason for 6.4% was social finance graciously provided us with a document that showed of all the projects that they currently have underway or have completed, here is the return on investment that we've agreed to. I also looked at similar investments on the marketplace. If we were to have an investment of our own, how much would we return, what would be reasonable, and I landed on 6.4%. Again, this is just my recommendation. You're welcome to change it if you so desire. The third conceptual term is a provision that would allow the payers, and I've put in parentheses who those currently are, the City of Austin, Travis County, and Central Health, to terminate the agreement without recourse or penalty if, after a specified period of time, the payers, all 3 of them, determined that they could perform the project in a more cost-efficient or advantageous manner. This is something that Mr. Giesland came to me and asked that I broach with you, and so one of the reasons I think it is a good idea, and I included it in my memo, is the board has to make 3 decisions here when they're considering providing funds to an entity. One is, does the funds we're going to spend serve a public purpose? I think all of you could agree that this project is likely to serve a public purpose. The second prong is, do we retain sufficient control over the funds? And so one way that we could establish that the project allows us to retain sufficient control is because the money we place is placed in escrow until outcomes are achieved. So we're not actually making a payment until an outcome is achieved. And then the third is that there is a return benefit to the district. And that's what this bullet point addresses. We may find that 2 years in, the return benefit to the district is so low and we could do this better on our own or with our partners. That is why that bullet was added. Bullet 4, this is a provision that would prohibit social finance, its subsidiary PATH LLC, or any other payer, being the city or Travis County, from seeking or using the funds that Central Health deposited in an escrow account for project costs that are unrelated to hospital or medical care. Even in the event that another payer, the city or the county, defaults or terminates the agreement prior to the end of the term. So the reason this bullet is in the memo to you is the agreement, as the last agreement I saw and I looked at, would obligate Central Health, its funds that it had committed to be used for project costs unrelated to medical care. So if the city, for example, were the party that decided to terminate the agreement, then all of the city's outcome payments may be made from Central, or project costs related to the city's outcome payments would be made from Central Health's money. Lastly, this is something that we've heard before in prior presentations, but including a provision that obligates social finance subsidiary to ensure 60% of the project participants are enrolled in the medical access program. So this is just putting into writing what has been stated to us previously. Those were my conceptual recommendations.
Thank you. Can I hear a motion?
All right,
Go ahead. Go ahead, sir.
no, you go ahead, you.
Mr. Chair, I'd like to make the motion contingent upon Social Finance incorporation of similar or more favorable agreement terms than those presented by staff. I move to designate $300,000 from the new initiative funds for the Pay for Success project that will provide up to 250 units of permanent supportive housing for homeless individuals residing in Travis County, Texas.
So I have a motion by Manager Bell, seconded by Manager Jones. Discussion. Manager Oliver.
So Holly, under the first bullet, they can seek the consent of investors, but investors can say, no, we don't consent.
Under the proposed term, that is correct.
Can we back out? Can we add language that would allow us to back out if we don't know who the investors are?
I think that that is something we can propose. Of course, I can't tell you whether social finance would agree to it, but I'm happy to modify the conceptual term to meet that demand if that's the will of the board.
Manager Bell.
I'd just like to sort of go over how we got here, mainly for your sake, Manager Zuniga. At the budget meeting on April the 17th, we had a discussion about this project. And the discussion was so that we could be all on the same page of where we are. There's a long history to this project, and I'm not going to go through it now, but we needed to be shown the timeline and shown where we were. So we did that at that April 17th meeting. And then we had a presentation of the what I would say the meat of the project to the board. And what I'm going to outline are just some of the really high-level concepts that I got from that presentation, okay? And I invite other board members to sort of outline the concerns that they voiced at the time with regard to the project, if I don't cover them, okay? So I don't mention them. Number one, it was obvious to me that the funds that Central Health would provide for this project would be held to pay for coordinated social services that will be provided for 250 homeless individuals that are in the project. And this project, for these homeless individuals, these 250 homeless individuals, would look at trying to decrease their utilization of high-cost medical services, as well as provide them with the mental health and behavioral services that they need, as well as providing them shelter in a home, okay? The reason this project is innovative is because it is defined as having some financial leverage. And what I heard as being the financial leverage is that this project would take investor money first and pay for these services. And then on the back end, we would look at outcome measures, outcome metrics. And if those outcome metrics are met, then our money would be used to pay the investors back. And those investors would receive not only the money that they put in, but they would receive a interest rate, okay? And you heard a little bit about that from Holly. The presentation showed that that interest rate could be anywhere between 7 and 12%, okay? There was little or no savings that could directly be attributed to Central Health. So in essence, what I heard was that the money that was being invested would be used to prove that investing in addressing a social determinant of health, no housing, and coordinated social services would make a difference in the health outcomes of those 250 homeless individuals. So it's an investment looking at a social determinant of health that hopefully will prove that better outcomes would happen for those individuals. There's some legal issues, which you heard Holly talk about. There's some sensitive issues. Number one, Manager Oliver brought up, was the transparency of those investors in the project. And number two was the transparency of the payments that were being paid to the other implementing organizations. That was a little fuzzy in the presentation. There was a lot of discussion about that. So that's where we are, and we're here today to try to make a decision on going forward. Now, I open it to any of the other members.
So, question, my understanding though of the decision today is not on this specific agreement, which we do not have yet, and the city and the county are still looking at, but whether or not we're going to designate some funds from our innovative projects fund, which is a budgetary decision.
Correct.
And of course, it is what it is. It's a
It is what it
budgetary
is.
decision. The other thing that I would add is that there was a part of that discussion that to me brought something to light that I really, I guess, hadn't fully contemplated before, and that is that these individuals, we are likely, we in the community, whether it's exactly us, we'd have to look, but treating and providing medical care for, but they're just cycling again and again through the medical system, perhaps, and not improving, perhaps, because of their situation. And so that was just since you weren't there, another part of the conversation that came up at that Budget and Finance Committee meeting.
Definitely.
I'd just like to piggyback onto what Member Greenberg said. Also, these are individuals within the targeted population of which we are legislative responsible for. It's not like they're outside of it. They are probably the greatest need because they are homeless, have no income for the most part, and are in need of access to care. And this model gives us an opportunity. You did a great job of outlining that. I appreciate it.
Oliver?
I would add, though, that the organization that is putting this deal together is getting over $1 million out of this, which could be going to house the homeless. And you'll have to go back and look at the prior board meetings financials. There's not a leverage, investors are not putting in money on day one. and getting it at the end of year 5. They're putting a tiny bit in at the beginning, so day 0, putting in a little more at the end of year 1, a little more at the end of year 2, a little more in at the end of year 3, a little more in at the end of year 4, and a little more in at the end of year 5. So it's not this leverage of like day 1, we're leveraging all these dollars. And then we are paying a little bit at the end of year 1, a little bit at the end of year 2, a little bit at the end of year 3. So I'm not seeing the leverage that was promised, but I am seeing over $1 million put together on somebody who does not provide any services to this targeted population that really is truly vulnerable, and should be receiving this sort of level of service. But $1 million is going to somebody who's putting the financing arrangement together, and then another $1 million is going to bonuses for service providers. $2 million of cost is folded into this, and I think that is, well, one, I think it's exorbitant, but I think we're reneging on our duty to be good stewards of taxpayer dollars by folding this level of cost in.
I just have a question. Given these comments, I would like to hear from Mr. Giesland or our finance folks, whichever staff is appropriate, and the representative social finance.
So I'll direct your attention to what is, I think, package, page 159. It's got another pagination of 6 on it. It's an attachment to the memo that was provided to the board when you all first discussed this. The financial scenario is really in 2 parts. One, it was the first that was completed before we knew about Seton's infusion of $1 million into the project. The second set of graphs immediately the page following on 160 take into account the Seton infusion. That range there that's on page 159 that shows the blue lines, and it says in the text box, range of best case and manageable scenarios, Central Health will fund a significant portion of the care in addition to the investor payout. Anytime you take private investor capital of $11 million or for any amount, there's always going to be some transactional costs on that. And to Manager Oliver's point, this, if it's fully successful, there is a significant cost added onto this. This is an expensive endeavor. That doesn't mean that it's inherently bad. It's not. But just to make sure everybody understands what's driving these results, is that in addition to paying back the principal put in by the investors, you also have to pay back, under certain scenarios potentially, the payout to the investors. And earlier somebody said net or return, not in the sense that we're looking for a net or return as a positive ROI. We're understanding that there will be savings here and that those savings could then be reinvested into care for people. So this is not something that goes to the bottom line, so to speak. It hopefully was going to generate some savings that then we could invest right back into the health care for these individuals, just as we have been doing for years. So I did want to clarify that point. So when you think about the volatility of this project, and yes, it's important to look at it from the humanitarian standpoint of what can we do, and it's, this is the project that we have before us right here. But yes, we could have done this on our own, but we haven't done it yet. Okay, so here this project is. But we need to understand that we could, best case scenario, have $1.3 million to reinvest in care, or we could have $1.5 million. And if the savings aren't there, what that means is we go back to contingency or we go raise additional tax revenue to be able to cover that. So that's what I wanted to point out with respect to the financial outcome on this. I think on and of course the Seton infusion, going to the second graph, the Seton infusion presents a much better financial scenario, but still there's a volatility there of an upside of 2.3 and a downside of a little over $500,000. I think the last point that I'll make, and thank you for indulging me to go back over those graphs again. In addition to this being an expensive program, the concept that Ms. Gummert laid out about us being able to come together as a city and a county and a healthcare district and take over the future funding of this, that's something I would strongly urge you all to consider, because I think it'd be a huge win for this community if we learn from this project. And not to create any animosity, but to say thank you to social finance and to the investors. But hey, now that we've learned this, and let's just arbitrarily say month 30, we're gonna buy the rest of this project and we're gonna fund it. I think that would be a huge win for the community. And we would get there because obviously we have some data that we learned from this project and would know what the risks are. Having said all that, my concerns are still the same, my recommendation is still the same. But ultimately, if you decide to approve this project, I don't want you to think that this is inherently bad. It's not inherently bad. It's just there's some things about the deal that just don't sit right with us at the staff level.
Can you clarify that statement, please? So that
Things that don't sit right.
Julie understands that you had originally made the recommendation that you did not support this. Is that correct?
That's correct.
Manager Jones, did I see your hand? Well, Manager Msatif?
I've probably said this multiple times. Housing is health. Housing is health. Housing is health. And we are looking at the scheme at this project, thinking about, as I echo what you said, our CEO, the opportunity of us collaboratively working with the city and county on this project is tremendous to our community and the benefit of the high utilizers of our care. And we're looking at it right now from dollar to dollar, but we need to be visionaries and think about what this can bring to our community in the long run. And also to look at, we don't have the capital to take the risk. I understand what you're saying in terms of model, but right now Central Health alone cannot fund this project. And we can learn from what data this project, we can have baseline data to move forward, and hopefully in the future, not just 250 individuals, we can actually recruit and house additional more. And they can and having this collaborative, coordinated care is a tremendous gain and benefit for our people. So I'm definitely in favor of us moving forward with this project, and I hope that we can learn, and I hope this is the start of many more projects that we can all collaboratively work together in this community. Thank you.
Manager Greenberg?
Yes, so, Mr. Giesen, when you were speaking, it sounds like in some ways you were looking at this perhaps in the future as we have seen with DSRIP projects, where we start something, we see if there's proof of concept, and then we decide whether or not to take it over and fund it in the future, which is what's happened with some of the DSRIP projects. And some of them, you know, turned out to be in the win column. You know, that program's winding down and we continued, and others, no. Is it in kind of in that vein that you're talking about?
And thank you for bringing up the DSRIP example. I think that's an excellent way to look at this, and I would characterize this as a privately funded DSRIP project. There's some structural elements, obviously, that I've already pointed out, and I won't go back over those again, but it's a good example.
Manager Waldes?
So, ECHO came to us out of the blue last year during the budget season, and that did not pan out. So during the discussions that came when they came to us again as we prepare for this new conversation, one of the asks that I made of them is A, who else are you getting your money from? And B, let's convene a collaborative partnership with all the entities that are going to be providing supports for ECHO, and that's going to be the city, the county, us, and anybody else that might have responsibility for the population that we're targeting, and that's the homeless, 250 homeless persons. To my knowledge, I never participated in that, but I wanted to, because at that meeting, or at those series of meetings, what I wanted each governmental entity to do was to take responsibility for their part of that pie, the pie that was going to be providing services. to this targeted population. It did not happen. I wanted to see the county and the city, which both have housing units, affordable housing units, to tell us what they were going to contribute in the form of housing units. We would be providing for the medical and hospital care for those very people. But we have to have a discussion about who's going to cover what, and in light of the fact that something might not happen, what was going to be the fallback plan for that. That did not happen. I also asked who else has been, how much money had they received over the past 10 years that they've been raising money for the homeless, so that I could see a pattern of success for what they were receiving from the city, from the county, and they could show me that they have managed the dollars sufficiently to prove that their models or their work in the homeless community was actually successful. That did not happen either. And so I don't take the ask lightly. I take it very seriously. But I also expected that there would have been some support, some willingness for them to come to the table and at least provide some of this information and some of this activity, so that I could see, yes, you're not coming here just for the asking of money. You're coming here with an intent to actually solve a problem that we have yet to solve. So that's where I come from with respect to our tax dollars. Making sure that we're all working together collaboratively to make a commitment for how we're going to resolve this issue, that it is a historic one. Previously, there may not have been metrics in place. That could be a flaw with how they were getting funding. But we still, in my opinion, needed to be able to see that and talk about it so that we could resolve that. With respect to this, what Holly presented to us, I had several concerns that I did raise to her with respect to the fact that the investors may not want to divulge their identity. The timeline of, well, let's give them a week, after the financing agreements are executed. Why? They should have provided that information to begin with. The representatives that came to this the last meeting that we had, they went to our staff and asked to have a meeting set up so that we could talk about it. That meeting never came to fruition. It did not happen. And not because we didn't want it to, not because I didn't want it to, but because somebody else didn't want it to, okay? We had a city council member here, and we had Ann Howard here, who was acting as a representative for ECHO. That didn't happen either. So why was there going to be 6.4% paid as a dividend, basically as a dividend for private corporations that are multi-million, probably multinational or multi-million billionaires, with respect to the amounts of dollars that they have in their accounts? Why are we going to have to be responsible for that should this prove to be successful? Are we going to get 6.4%? No. What we do is get to pay for that if there is success in this, and we would hope that there would be, because I wouldn't want us to invest any money unless I knew that there was going to be success. But you have to have a conversation with the parties to be able to know or determine that, especially as we're talking about the provision of wraparound services by all the entities, including Integral Care and others, for that to be successful. There does not appear to be any specified time limit for their program for us, I guess, to decide whether or not it's cost efficient or advantageous. And with respect to the payers, I didn't understand, Holly, if you meant that all three payers have to decide that they could do this in a more efficient manner, or one of the three could also decide that they could do this in an efficient manner. All three jointly have to agree?
The way that I have proposed the concept, as I understood Mr. Gieslin's request to me, is all three have to agree.
Jointly.
Jointly.
And that's putting the responsibility on other entities that we do not have any control over. The 60%, many homeless people that I work with have Social Security benefits. They're Medicaid and Medicare recipients, and they have their checks sent to a box that they go and they pick up their checks from. Some do not, but those should be our MAP patients that we would be providing services to. And if I'm looking at the alternative for what my dollar can do, I would rather make sure if they didn't have Social Security benefits, that they actually had MAP benefits. And if not that, then let's pay for their premiums and they'll have actually a continuum of care under Sendero. Okay, that's it. But with respect to this motion, I don't understand why it's saying for a successful project, it's going to go towards the provision of 250 units of permanent supportive housing. Okay, that's what the motion says. For the provision of 250 units of permanent supportive housing.
Can we yield the floor to Mr. Giesman?
Yes.
Just for correction on the motion, we're not paying for housing units. I mean,
No,
this program pays for the
For the
program.
project,
Right.
right.
For the ACT teams, but I just wanted to clarify that because the way that I thought I heard it, it
Yeah.
makes it sound like it will fund 250 units.
No, it's going to fund a project that is requesting up to 250 units of permanent supportive housing. If we had had the conversation with the city and the county, and HACA and the county housing department, we would have been able to see whether or not we could do that separate and independently, okay? But we cannot do that or have that conversation unless everybody's at the table. Hence the need or the request, at least on my part, for the convening to occur so that we have a comprehensive conversation about how we're going to address the homeless. And then with respect to their requests and asks today, it would be from what I understand, they're asking for $300,000 from us every year for a period of 5 years. Is that correct? And then $300,000 from CCC, which we give them their money for a period of 5 years, every year. So that's actually $600,000 that we would be providing to them on a program that maybe I'm mistaken, didn't seem to see any movement to collaborate or participate, additional requested information from me.
If you can quickly wrap it up.
Okay,
In the interest of time, we're
so
30
basically, to wrap this up, what I'm saying is that I again expressed my concern over the fact that there was a failure or a mistake or a misunderstanding in providing this information that I really needed to have for over a year. And I don't believe I was the only person that would have wanted to have those questions
Thank you,
answered,
Mr.
but
I
thank
really
you.
need to wrap this up and move on.
Thank you.
Manager Giesman, Great Burke, sorry.
No, I just wanted to hear from Mr. Keys.
I
just appointed
Manager Mike.
from Mr.
Sure, Mike.
Keys because it looked like he was trying to add some information.
Yes, to answer the question, and so there's some material here that's in the packet. It's the same materials from the prior meeting from Social Finance. It spells a lot of this out and answers some of those questions. But I want to be clear about fiscally how this will be managed.
Yes, that's what I want to
The money
hear.
gets put up, and
In an account.
after the evaluation period, then it flows. And so what you're committing to is to commit up to a certain amount of money, in this case, 300, 600,000 total from the enterprise. Whether or not that full 600 gets paid out, that's still subject to the evaluation process. So it's not a direct transfer of cash.
This is after the evaluation
If
process.
I
I'm sorry.
led you to believe that, I didn't mean to
So
take you down that path.
Can I ask a question that's specific to that? So you're saying the money gets put up, but it's like a DSRIP project where if they don't meet the outcome measures, then they don't get the funding. Is that correct?
In a manner of speaking, yes.
So with respect to that,
Manager, Oliver, please.
But to the point of the fact that there are private investors investing in this, they're not doing this to lose money. Their shareholders do not want them to lose money. And you and I know this. And the reality is, if we can go to page 182, at the end of this project, it's going to be $16 million through Central Health, City of Austin, Travis County Commissioners Court that are paying back $16 million to people who have made $11 million of investment. That's a huge return, $5 million. Again, assuming everything goes as planned, but I'm sure that they want everything to go as planned. They're not in this to lose money. And this is not to say that I am against, I think this project is a fabulous, Ron, to your point, we need to be doing this. I agree wholeheartedly. And I would love if ECHO could just do this and just pull in City of Austin, Travis County Commissioners, and Central Health. You can see it's not a huge investment on the front end. You can look at on page 182, $700,000 between us, City of Austin, Travis County. That would be easy to cover. And each year's costs are not outrageous. They're not. I mean, hovering right around $3 million a year between 3 entities. Plus you have Seton, and then plus you have St. David's Foundation.
And
I just don't
physical health.
understand why we have to inflate the cost of this project because investors are involved, when we could be doing it without them.
Yeah, I'm gonna go to Manager Jones next because he hasn't spoken.
I'd like to call the question, Chair.
I need a
I
second
think
for
we've
that.
discussed this.
I need a second.
I'll second.
All right, so I have a motion by Manager Jones, seconded by Manager Musaitif. I need a 2/3 vote on that.
I just need to ask a question. Just like Sherry asked Mike to clarify something on his comment.
I'm so sorry, but this is not a debatable motion. You've got to finish this motion first.
You gotta move on with this motion. I want to hand count again, because we need a 2/3 to move on. All in favor of table, sorry.
Just, may I explain something that councilors pointed out? Anytime you have a call to question motion that takes priority over anything else, there can be a period of subsequent question asking, but this motion needs to be disposed of first.
Then you can.
And then if there is a question about this particular motion, you can state parliamentary inquiry so that we can answer the question about the motion.
Well, this was actually about a statement you made. That's for clarification purposes.
Manager Valdez.
You made a statement about the money is going to be
Well,
held. Oh,
but
I'm sorry.
the motion's still
Have it
on
on
the
the
table.
floor.
We haven't
Okay.
You can
disposed
dispose
of
of
the
this
motion.
motion first, and then you can, I think, is what he's saying.
I can do what you
Any
did.
discussion on the motion on the floor currently? Okay, I'm gonna ask for hand count, because we need a 2/3 vote. All in favor? Aye. Hands up. 1, 2, 3, 4, 5, 6. Motion carries. All against? 2. Anybody abstaining? All right, motion carries. So we're calling a question. So the motion on the floor is, as previously discussed. So now we're gonna vote on that.
Or, the only thing would be is that, I believe Manager Oliver was trying to propose an amendment to the motion on the floor, and, Dr. Bell would have to accept that motion.
Okay, so Manager Oliver.
That was under bullet number 1.
I accept those.
Okay. So we have a motion and an amendment to that motion.
What is the amendment, please?
It was to add that we can back out of this, if we back out of the agreement, if we do not find out who the investors are.
Again, as we've heard what our CEO has recommended. And so I'm going to ask for a hand count so we can see who,
You accepted that amendment.
I accept that amendment, yes.
yeah, that doesn't need a second, right, Holly?
Correct.
That's correct, because it was his motion.
All right. So all in favor of this motion with the amendment, say, raise your hands. 1, 2, 3, 4, 5, 6. All right, motion passes. Anyone voting against? Anyone abstaining? Show that managers, any guys abstaining, and the motion passes. Thank you, board. I know that was a difficult one.
Mine was just a clarifying question.
I'm sorry to Manager all this, but
Bless
we
Mike.
have to move on. We can't just keep going on and on and on. We have to move on.
It's just a clarifying question.
All right, item 8, consider and take appropriate action on the Downtown Campuses Committee's recommendation to delegate contract negotiations and executive authority to the president and CEO in connection with the realignment of Red River Street.
What, we can either ask for a brief recess since Mike gets involved, or we can start with Manager Musaitif, who chairs the committee at which
We have a short bio.
Break.
Okay, thank
Can we stand down? What's that? We're gonna stand down so we can go to the,
5
get some
minutes.
food. 5 minutes, let's get some food.
now, they're both running for public
All right.
office.
It's 7:23, so let's reconvene the meeting. So we were on agenda item 8. Consider and take appropriate action on the Downtown Campus Committee's recommendation to delegate contract negotiations and executive authority to the President and CEO in connection with realignment of Red River Street. Mr. Giesland.
Yes, members, this is pursuant to the conversation that we had in the Downtown Campus Committee. I guess actually before I go any further, I should ask if Chair Musad had any comments on this. I do have some quick comments to make, but is there anything that you wanted to add to this?
Well, thank you.
And I'm sorry, I'm talking to the chair. Could you-
Please.
On Friday, we had a really robust discussion over this item, and it is in really relation that it's a land swap exchange with the city. And I know one of the board members or a couple of the board members had some additional concerns and questions related to this item, but all I can tell you, this is really just a simple land swap with the city and us, Central Health, and it will not, I don't foresee it making any definite decisions in how our redevelopment plans for the whole Brackenridge property. And if you have any additional questions related to this item, I'll be more than happy to answer it. And I think that within the packet here, it has a really good presentation that Mr. Stephen Lamb presented the terms and conditions for this land swap, and I'll just get back to you.
Thank you, Manager. Thank you. Mr. Giesland.
Yes, so as Manager Musad stated, this is an interlocal agreement, and there's really two key parts to this to understand. One is it adds additional floor to area ratio, which allows for greater density, and two, it's overall site plan approval. And the value of this to the development and ultimately to funding our mission for healthcare is that, one, it gives us options, and two, it gives us a process advantage. And so by having that one-stop approval process for the entire site approval is critical to advancing this development. So those are two very important points to keep in mind. So I think overall, as Manager Musad mentioned, there's a land swap here that seems like it's at the center of it, but the reality is there's these other benefits to the overall development, that the city would agree to the site plan application. We'd have a condensed timeline for permit reviews, including the demolition permit review, which is separate from the site plan requirement. Ultimately, the city would reimburse Central Health for Health South utilities costs, and we would obviously talk about flexible parking requirements, as Mr. Lamp had mentioned in the board meeting as well. So these are some of the things to be negotiated, and with that, we would certainly seek approval of the recommendation to negotiate these terms with the city.
Would you read the motion into the record?
Yes, I move that the board approves the request to delegate contract negotiation and execution authority to the president and CEO in connection with an agreement to be entered into between Central Health and the City of Austin for the realignment of Red River Street as recommended by the Downtown Campus Committee.
Second.
Okay. I have a motion on the floor by Manager Greenberg, seconded by Manager Valdez. Any discussion? Any questions? Manager Jones.
Yes, I raised the issue at our downtown committee meeting regarding the east corridor view because I was concerned about the ability for citizens in that part of the city to have that capital area view, which is something that we've prided ourselves for quite some time. My goal was not to undermine the effort of the CEO to do what we're asking him to do. That was not the intent. But to send the message in his discussions with the city that we'd like to, as they seek to develop that area, to keep that principle in mind. I think that as Austin grows and develops, we need to still have a link between the capital city, i.e. the capital, and the other communities around. And I think that type of view will continue to do that. If they're going to, also, I think it's important as they look at developers, the type of development that occurs there. If you were talking about density, yes, you go up, but you can also create other kinds of innovative ways to achieve density as well. So my message is really to you, CEO, that I'm not opposed to it. I will vote to support this, but I want that message to be reinforced from Central Health to the city as you talk with them. That's the intent of what my issues were.
Manager Bieber?
I would like to reiterate what he said. I think that's a fair thing to ask.
Thank you.
Thank you, Manager Oliver. And Manager Ostaisiv?
I think what makes Austin is unique, and we need to preserve the beauty of Austin and the history of Austin. And I think we will definitely, as our plans progress and we move forward, we're going to keep the heart and essence of Austin preserved. I think learning and reading all the messages about what Brackenridge meant to our community is truly heartwarming, and we want to preserve that and as meaningful, as beneficial as possible to us and our community. So I definitely echo your sentiment, but we'll overall look at the bigger picture, but we need to preserve what makes Austin, Austin.
Thank you, Manager Ostaisiv. Mr. Musil?
Yes, in response to Manager Jones and Manager Oliver's comments, certainly understand. And up to this point, we've agreed that we would work with the existing capital view corridors as are currently laid out. But I also understand that this is important to the board, and if anything should change around that, we would certainly want to come back to you. So I'm not going to put my signature on something if it at least appears to me, or if I'm not certain how this might affect the capital view corridors as they're currently laid out. But up to this point, we've expressed, in fact, it's even laid out in the master plan in terms of the way the buildings are situated in the conceptual drawings. Now, granted, they're conceptual drawings, they're not finalized yet, but how those would accommodate the existing capital view corridors. So understood.
Thank you.
Any other discussion? All right. All in favor say aye. Aye. All against say no. Any abstentions? Motion passes. All right. Agenda item 9. Discuss and take appropriate action on a healthcare service delivery expansion in eastern Travis County, including project budgets and projected project timelines.
Members, I'll need to update you on and we'll need to go into closed session on this one, but I'll need to update you on a potential tract purchase in eastern Travis County. And so for that purpose, it involves the privilege under 551072 of the government code regarding real property. I would ask that we go into executive session.
Okay. I announce that the board is convening in closed session to discuss agenda item 9 under section 551.072 of the Texas Government Code regarding real properties. The following staff may remain for closed session. Who may I ask?
I would say Perla Cavazos and Emily Ferris.
Yeah, Emily Ferris and Perla Cavazos.
Oh, it's Cheryl.
No,
And Cheryl.
I'm sorry, I can't see who you're pointing at.
Cheryl.
Okay, I'm sorry, Mr. McDonald will be taking Emily's place.
It is May 29, 2019. It is 7:47. We're coming out of executive session. We discussed item 9, discuss and take appropriate action on healthcare service deliveries expansion in eastern Travis County, including project budgets and project timelines. Do I hear a motion?
I move that we go ahead and authorize our Central Health CEO to delegate the contract negotiation and execution authority, to Mike in connection with the purchase of a tract of land in Hornsby Bend, Austin's Colony area.
Second.
Motion by Manager Valdez, seconded Manager Greenberg. Any further discussion? All in favor, say aye.
Aye.
All against? No? Any abstentions? Motion passes.
Thank you, members.
Next item will be agenda item 11, discuss and take appropriate action on an update regarding Sendero Health Plans, Inc., including the effect of federal, legislative, and regulatory actions. Dr. Allison and is Wes here? Okay. How are you, Betty? Hi. Thanks for coming. Dr. Allison, thank you for coming. Wes.
Hello, everybody. We'll jump in, we'll do this in open session, and at the end, we can talk about whether or not we want to continue discussions in closed session. And,
You got a chance to meet Dr. Zuniga, Wes?
Thanks, sir.
so first I'll let Robert do most of the talking today. He returns to us having recently been honored at the College of Preventive Medicine as a rising star.
All right.
Not because of anything I did. It's all his. So he'll talk first, and then we'll kind of veer back towards Premium Assistance Program and the CHAP program, and I'll finish up.
We put it up or?
Oh, yeah, we can, I'll go ahead.
Okay. We don't need to put it on the board, right? Thank you. Members of the board who I haven't met yet, it's very nice to meet you. My name is Robert Allison. Again, it's really, it's a pleasure. Thank you for the opportunity to speak with you today. So I'm going to start by talking, I know we don't have much time, and I think we're the last game tonight, so I don't want to take up too much of your time. Briefly, at the last meeting, we were going to talk about mental health and what we're doing for mental health at Sendero, and then I'd like to talk about a case briefly. So as we know, mental health impacts physical health. There are many great studies on this. Most of the literature comes from the cardiovascular side, where we've seen depression is associated with increased mortality and other adverse outcomes. So when we look at the CHAP population, we found that 35% of our CHAP members have a mental health disorder. When you compare that to the general U.S. population, that's about 2 times the general U.S. population. So it's a significant problem that we have to address in our population, or in this CHAP population. So what has Sendero done about it? So number one, directly contracted with the local behavioral health network. We've recently added an expert behavioral health medical director, Dr. Matt Keats, who's a psychiatrist. He was doing this for Anthem for many years. He's also an NCQA compliance auditor, so he comes with a lot of experience. We've partnered with Integral Care. We've added in-house complex case or complex care coordination for members with both severe mental and physical health conditions. We've also we're in the process of building a population health system that can uniquely identify members with undiagnosed mental health and depression and anxiety specifically will be expanded to other mental health disorders. As you may know, about half of all mental health is undiagnosed, and therefore it's difficult to treat when you don't recognize it or diagnose it. So actually it'd be nice to have, to just show the next.
Go to the next.
Oh, you're controlling it? And that shouldn't.
I know it doesn't.
There we go. I'm not sure how that got that. Okay. So this is a case, kind of a success story. Is a success story on our side. I hope to present, and I look forward to presenting many, many more of these. But I presented this last week at a national conference that was very warmly and well received. So I'd like to go over this with you. By the way, the name and the picture the demographics in the picture have been changed. This isn't the patient. The picture's for illustrative purposes only, but this is a real patient. So I'm presenting Mr. Garcia. He's a 60-year-old homeless man with end-stage renal disease. He's previously on MAP, as I said. For the past few years, every time he feels terrible, he's been taking the ambulance from the shelter to the emergency department for inpatient dialysis, and this happens about every 3 weeks, and sometimes it results in an ICU admission as well. He has access to outpatient dialysis through Sendero, but his case manager at the homeless shelter has always said, no, he refuses, he's really not interested. So trust but verify. So when I found out about him, I sent one of our community health workers and behavioral health case manager to the hospital. Said, today, go, he's an inpatient, go meet him today. Get to know this guy, what's going on here? They not only met him in the hospital and kind of built a relationship, but then kind of navigated him back to the shelter, followed up with him again in person. And it turns out he was not against outpatient dialysis at all. He just had a number of social determinants, I should say a number of challenges that kept him from that. So the next slide, I'll talk about some of those. So number one was transportation. So the ambulance took him directly from the from the shelter to the emergency room. And in terms of health literacy, he had always gone to the emergency room and received inpatient dialysis. For the past couple of years, he didn't realize that outpatient dialysis was really a possibility, that he had access to that. He didn't realize that you can get dialysis before you feel terrible. In fact, the inpatient docs have told him, through him, he's told us, they call him Mr. 9 Lives because he's really sick every time, waiting to get dialysis and being admitted is pretty severe. So in terms of dealing with addressing his social isolation, he felt very socially isolated at the shelter. And this also kind of fed into his wanting to go to get inpatient dialysis because he had actually built a relationship with the ER docs and with the inpatient staff and the dialysis staff, so he felt like he was connecting and being cared for. So how did we address a number of these? So transportation, that day I set up a Lyft account His community health worker now, so we have just one-on-one. This will be the community health worker that will take care of him, that will see him, coordinate with him all the time. She met him at the shelter first, then he took the lift to outpatient dialysis. She met him at outpatient dialysis, and then she met him, so outpatient dialysis is 3 times a week as a standard. She met him 3 times a week, including Saturday, until he felt comfortable and he had built a relationship in that clinic, or in the outpatient center. So addressing his mental health needs, the behavioral health case manager that had initially met him in the hospital has connected him, or is in the process of connecting him to Integral Care, which has other resources as well. In terms of his medical needs, also kind of because of this transport issue, he had been somewhat lost to follow-up. So we coordinated with community care, case management. They've been very helpful. We helped him make a primary care appointment to address kind of the other things, his diabetes with an A1C greater than 12. He had a DVT, a deep vein thrombosis, and many other cardiovascular risk factors. In terms of access to healthy food, at the shelter he kind of got what he got, and that's good, but also it was not a diabetic diet. So we're working with, we're trying to get him connected with Meals on Wheels. There's a little bit of a fee, so we're trying to figure out, but definitely leveraging or collaborating with community organizations to get him not only access to food, but to an appropriate diet. And the other things, lack of housing, unemployment, these are particularly unemployment are upstream social determinants. We're working with community groups on these, but that certainly requires the help and the collaboration of the entire community. So kind of finally, we're going through, this has been a successful case. There's another one that just came to my attention yesterday, potential success story like this. So now we're going through our database of every single Mr. and Mrs. Garcia that we can find to kind of address social determinants, and obviously in this case and in those future cases, potentially make a significant difference.
Thank you.
Thank you. Yeah, and these are the kind of stories like we
That's
knew
right.
would happen. We are very happy that they happened, in this case too. So no matter how you look at it, but this is a member of the community for decades. He was a former homeowner. Pretty sure I'm not mixing this up. Got sick, lost everything. Not unusual, but of course he had roots in the community, stayed here. So we're happy that he's back on track to, once he gets the medical needs done, that makes it easier for him, unemployment and everything. From the system standpoint, it's like here was a member who was on track to easily use hundreds of thousands, $500,000 easily. $500,000 a year in services, just because he was going to the ER and getting emergency dialysis. And luckily, through a lot of hard work, that's the advantage of managed care. Is that
That's right.
No, because we control the whole payment, we have the resources to allocate and follow through. So in this case, yeah, we cut him off with 6 figures. And on top of that, we get funded for all of this. Like we'll get funding specifically for this member, 6 figures easily. So in this case, yeah, spectacular home run. Thank you, doctor. And we're looking forward to many more of those. The last thing I wanted to talk about real briefly, the next slide, doesn't have to be brief, as long as you want. So just the regular update. We did file our Q1 financials. They will be public pretty soon if they're not already through TDI. Those financials reflected projected break-even performance for Q1. The chat program, the things I can say publicly is it's doing exactly what we wanted it to do, delivering care and earning funding, which previously was unavailable for these uninsured members. In June, just as a reminder, we get the first formal look from the actuaries, a review of the risk adjustment, which, and additionally the claims, which gives us a big view into how our year is going to play out. And of course, we can talk all about this more in future closed sessions. Today, the one thing, what we brought is, you remember last fall, as part of the business plan to go forward, There was some agreed upon reporting, and what we did was kind of like reformat that into a single page, which we think will be easier to follow. Because we have very light data, we can do this either way. We can go over the proposed template in open session without numbers, because numbers, just so you can be comfortable with it. And, or if you'd like, or if, depending on, let Holly weigh in, we do have a few numbers we can share, basically projections and things that we do want to share. So it's probably more up to the pleasure of the board.
Okay. Go to closed session.
Go ahead, if we're gonna go into closed session, and do me a favor and read the announcement under item 10.
Okay.
I'm gonna give you some attorney-client advice first, and then we'll go from there.
Let me, item 10 or item 11?
Under item 10, there's an announcement that includes consultation with attorney,
Okay.
and that's what I wanted to read.
All right.
Go in closed session, can I,
What's that?
before we go in closed session, can I follow up on a slide?
Go ahead.
Thank you, well, appreciate it. I think your presentation reaffirmed our need to focus on health, not just healthcare, and that's just, everyone on the board knows my position on it, and that's what we need more of these patient stories to help us, even on Central Health scale, how can we better serve our community by serving health, and we know that cost of healthcare is quite high, and there's a huge cost saving if we address these health drivers of our individuals, especially the high utilizers of patients. That's just really I wanted to make a statement about, and thank you.
And I just want to chime in for the need, and thank you, Wes, for the community health worker tie-in. Because without that community health worker, without Sendeto's commitment to community value-added relationships in our own communities that have such great needs, you wouldn't have that competent care. Thank you. I want to thank you, reiterate. That's why I support Sendeto.
Okay, anyone else? All right. I announced that the board is convening in closed session to discuss agenda item 11 under section 551.071 of the Texas Government Code, consultation with attorney, and section 551.085 of the Texas Government Code, governing board of certain providers of healthcare services. And with that, I'd like to have the following staff remain in the room. Obviously, Wes, Dr. Allison, Betty, Cheryl,
So Emily
Emily,
and myself.
Mr. Giesland, Stephanie Bredla.
So at the beginning, it's just gonna be Central Health staff, because this is legal advice given to Central Health and not to Sendero.
No, so,
So not Central staff?
no, they have to.
We'll bring you in.
Okay. All right, so let me reread those people, or no?
Y'all will be in the wings for a moment.
Look, come on, I'm kind of proud of this template. Don't be knocking
Great,
my board
I
here.
Ready to go? All right.
Yeah.
All right, today's May 29, 2019. It is 8:27, and we're back in regular session. Mr.
Yeah, sorry
Yes.
to, hope we didn't ask the wrong question there, so, but we're happy to go over this briefly in open session. So this is kind of an amalgamation or a compilation of all the pieces of the report, from the business report that we're gonna talk about. And with these numbers, we're pretty confident that you can get a good idea of what's going on with the program and the pieces. As discussed, a lot of this cannot be in public open session because it is highly competitive information. But for now, we'll just go across the top. So if you kind of remember the key pieces from the business plan, there were some membership numbers, a little discussion about relative risk, which helps us understand the profit and loss statement numbers, net income, year-to-date reported net income, I should say. Along with that, there's some numbers that aren't public. Based on that, we will be discussing our projected annual net income, the associated projected surplus, and the associated RBC, risk-based capital, which is the measure of insurance, kind of health, safety, regulatory standard for numbers. So that's across the top. And then down the page on the left is just the different sets of numbers, different scenarios. So the top portion, which we can somewhat discuss publicly, is what is in our public quarterly filings with the Department of Insurance. These are open to requests from anybody, so we don't mind sharing those. Below, we break that out in a few different ways, and we will be adding the projected numbers. So, of course, everything together. And then for the purposes, relevant to Central Health, we can split up our membership into the baseline non-premium assistance members. That's the majority of our membership. The Central Health Access Base Premium Assistance Program, which is basically the musicians and some members on Silver. There's about 1,000 of those this year. And then the last bit of numbers at the bottom, numbers specifically associated with the 200 people in the Central Health Access Program expansion, the CHAP members forming them insured. And then across the bottom, we'll have the rolling 3-year projections for the 3-year. So that was a lot. But hopefully with this, so this way we can just come back to you with the same report each time, adding some more numbers and filling in, and depending on guidelines we can talk about in closed session. So any kind of general questions?
Any questions, board?
Nope. Thank you for the template.
Sure.
Wes, thank you so much. Again, this is an informational item only, no action is necessary.
Correct.
All right. Thanks, Wes. Thanks, Wilson. Thanks, buddy. All right, agenda item 14, confirm the next regular board meeting date, time, and location. The next Central Health Board of Managers meeting will be held on June 19th, 2019 at 5:30 p.m. at Central Health Administrative Offices, 1111 East Cesar Chavez Street, Austin, Texas, 78002. With that, do I hear?
Yes.
Okay. All in favor, say aye.
Aye.
Thank you, members.
Thank you.
Right, Cynthia?
Yes, please.